Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast here at Countryside Equine Hospital. We're back in the old studio, old treatment room 1. I got Dr. Caitlyn McCaulley with me today. How are you doing today?
Good. How are you?
I'm doing fantastic. So we got a cool episode. February is dental month.
Yes.
I don't know who picked that, but the whole world decided that we're going to celebrate dentistry
for all species
of February. All species people.
Yeah.
Dogs, cats, horses.
Yeah.
So we thought it'd be a great lead-in. We're going to talk about dentistry.
Mm-hmm.
You know, one of the things that I've got no proof behind this, but one of the things I think about a lot is dental care got really big about 20 years ago. We decided that dental care in horses was important.
Yeah.
And horses started living longer.
Mm-hmm.
And it sort of makes sense because once they run out of teeth and they can't eat, that's kind of our demise.
Yeah. I always tell people, and I always think about it like when you think about nutrition and you think about feed efficiency and all of those things, everybody focuses on the GI tract and the abdomen, but it starts in the mouth. Like the GI tract starts with the mouth and apprehension and mastication and all those things. And if you can't do that appropriately, the rest of the GI tract doesn't do its job as effectively. So
right, teeth serve an important function. You've got to get that food particle smaller so it can digest.
Mm-hmm.
So if your teeth aren't working right, your food particles are going to be too large, and we're going to have issues with digestion, and that's going to lead to digestion or issues with absorption, which is going to lead to issues with weight loss. Yeah.
I think too, you saying that it has become really big in the last 20 years, I think the knowledge has just exploded, and we've had a huge expansion of what we know, what we can do, things that people have tried, and we're still learning. This is still an area that there's a lot of room for growth and change, which is exciting, I think. But it's become fairly routine, but still a big area for lots of expansion and knowledge. So.
Yeah, it's, just in my short career over the last 15 years, I guess since I started vet schools for 19 years, watching dentistry change and the things that, and that's one thing I tell people is like, every time we think we have a truth, we have this thing to hold on to, we have this fact, this one constant. Just wait a minute.
Yeah, it'll change.
It'll change. And dentistry has done that quite a bit.
Yeah.
And we'll get into some of that. So if you're watching on YouTube, you'll see we've got an anatomy specimen up here. If you're not watching on YouTube, you may want to flip over to it because we're going to probably reference this quite a bit.
Yeah.
And, so let's talk about what makes horses unique.
Mm-hmm.
What makes horses unique?
Horses are very different from humans in how their dentition works. So they have a total of 36 to 44 teeth in the adult, depending on do we have all our canines, do we have all our wolf teeth. Those are kind of the variables there. But they are what we call hypsodonts. So they are born with, in their cheek teeth, so the ones along here, they're born with all the tooth that they're going to have. So they have very, very long roots. And as that horse chews and that tooth wears down, they continue to erupt. And so they are, like I said, born with a very long root. And then as they age, that root gets smaller and smaller because that tooth has erupted and worn down.
We're talking about the molars and premolars. When we say cheek teeth, we're talking about molars and premolars.
Yeah. And so that predisposes them to lots of problems with wearing patterns, their anatomy as far as the width of their jaw. So the maxilla or the top jaw is wider than the mandible or the lower jaw. And so those teeth are a little bit offset. And the teeth themselves are actually more narrow on the mandibular aspect as well. So as they chew in kind of a circular or side-to-side motion, they get these sharp points on the outside on the top teeth and the inside on the bottom teeth. And so that can cause some problems. But again, they just as they chew and they wear, they get different problems with what we call occlusion, or the chewing surface, and so that's something that's unique to horses, and other species have it as well, but I think to a lesser degree. And horses are one that we typically will go after, and we will adjust these problems and look into these problems. But just the anatomy of the tooth itself is also very unique. Horses, our tooth is covered in enamel, and then all of the secondary structures are inside that enamel. Horses, their tooth is like a convoluted, everything's just all wrapped up in itself. It's hard to explain unless you truly look at a tooth, but it looks like old school, like, what is it, taffy that's like in the ribbons, kind of.
Well, and I think let's go all the way back. Like you covered a lot right there.
Yeah, I did. I tend to do that.
Yeah, you covered a lot. So let's go all the way back. Let's start back. Let's start back at the hypsilon portion of this. A lot of people think horses are like beavers. A beaver's tooth just grows and grows and grows, and it will continue to grow for that entire beaver's life.
Yeah.
Hypsilons are different in that you have all the teeth. They're anywhere from, depending on the horse, they can be anywhere from 2 to 4 inches.
Yeah.
And they continue to erupt.
Yes.
They continue to push down.
But once they're all erupted, that's it. And
that's
so
it.
We run into something called expired teeth, which is where there's no tooth left to come down or erupt, and that typically happens starting in the late teens, early 20s. But the horses now that are getting into their 30s, they truly have no teeth left.
Well, and I think one of the things there too is with proper dental care, we're actually extending the life of that tooth. We'll get into what some of those things are.
Yeah.
But that's one of the things I hear a lot is that, well, they just continue to grow teeth their whole life. It's like, no, they have all the teeth.
Growing.
They just erupting
Yeah.
it. And that's a big difference. Our teeth, once they're in, we're done erupting.
Yeah.
But a horse is continuously erupting. A beaver, his teeth just grows his whole life. So horses are not beavers.
Yes.
So
thankfully, that would be terrifying.
And that rate's pretty consistent, about 2 to 3 millimeters a year.
Yep.
So that kind of gives you an idea of how long that tooth could last.
Yeah.
When wear starts to exceed that, that's when we can run out of teeth a little bit quicker.
Yep.
So, well, let's get into the mandible and maxilla. You mentioned a few things about the mandible being narrower, and about the teeth being narrower. So let's talk a little bit more about that.
Yeah, so especially if you can look at the video portion, you can physically see it as you lift the skull up. So the maxilla, which is the top, is again more wide than the mandible is the bottom, and so those teeth on the bottom are also more narrow as the jaw is more narrow, and so that leads to how the horse chews. They chew in a kind of circular side-to-side motion, and so because that jaw is not offset per se, but it's not completely symmetrical from top to bottom, then that's when they get their wearing pattern, so they get those sharp enamel points. And so as they eat more fiber and more roughage that's really stemmy, they'll use more of a full jaw sweep, and so they'll go completely from side to side, which helps to wear more appropriately and to kind of wear down those sharp points. But a lot of domesticated horses that are eating, softer hay and grain and soft grasses, they don't have to use that jaw sweep completely, and so then we tend to get more sharp points just because of the width of those two jaws are not the same.
Well, and that's one of the questions I get a lot is people say, well, why don't the wild horses need floated? One, they are on a more heavily roughage diet.
Yep.
But the other thing that a lot of people forget is in the wild, if you find a 10-year-old horse
that thing is
in the
old.
wild, that's an old wild horse.
Yeah.
All right, so we're going back to, 30 years ago, if you had a 20-year-old horse, you had a really old horse. Now, I've got athletes that are 20.
I said something the other day to a client. Her horse was 23, I think. And I was like, as they get older, and she's like, he's only 23. He's not old. And so, that's changed. She was a little offended that I said that. And I was like, no, it's just older. Yeah. But it's changed.
It has. 20 years ago, you didn't see many. You go back 30 years ago, 20s was really cool. Your horse made it into his 20s.
Yeah.
But they were usually like, okay, we're we're just hanging in there.
Yeah.
And now 20 is the
They're
new
still going and
15.
doing, and
I mean, it's,
yeah.
But and I think that's one of the differences. You know, a lot of people look at the wild horses, but I think one thing you got to remember with those is their life expectancy is not near what a domesticated horse's life expectancy is.
And so we're not seeing the changes in their teeth that we do as we see in our domestic horses, and they probably honestly could benefit from the float in the wild. But
one of the things I think about a lot is if you go back, if you go back to caveman days, they didn't go see the dentist.
No.
You go back, 300 years ago, nobody was going to see the dentist.
And they lived
a long, healthy 20 to 30 year life.
Yeah.
And now we're routinely pushing into the 90s.
Yeah.
And so I think you have to think about that as just because something is occurring in the wild doesn't necessarily mean it's right.
Or better.
Yeah. Better is a better choice of words.
Yeah.
So, and then, going back to the grinding surface and having to chew that forage and grind that forage. And I think that sets us up for how that tooth is constructed. I always like to say it's inside out.
That's a good way to put it.
It's our teeth have the enamel on the outside,
yeah,
and then you have the cementum on the inside,
yeah,
and then the dental pulp right in the middle. Well, our dental pulps are still in the middle of the horse's tooth, but the enamel's on the inside of the tooth, forming those ridges, and then the cementum's on the outside, and so it's an inside-out build.
Yeah.
When you look at our teeth, you see the enamel. When you look at a horse's teeth, on the molars, you see more cementum than you do enamel.
Yeah.
So that's, and you got to have that for grinding.
Yeah.
Like you said, if you don't have it, you're not grinding anything.
Nope.
That's what we call smooth mouth, right?
Yep.
Some of these horses will get to the age where that tooth is just smoothed out.
Yep.
They don't grind so well anymore.
We can't have hay anymore, guys.
And those things are important.
Yeah.
Like if we've got to be able to grind, and so everything we talk about is how we can optimize that tooth.
Yep.
For better mastication, better chewing.
Yep. And I think, too, people, when their horses do get up into an age where they have a smooth mouth or they have, they're missing lots of teeth and they're like, oh, well, they can't chew anymore, so why do a dental? We don't need a dental exam. We don't need it. I'm like, but we do. There's still things that we can address and we can change and make that horse more comfortable because mouth pain is real. Like, you don't want to eat when your mouth hurts. And it's incessant. Like, it doesn't go away. It's not something that comes and goes. It's just there all the time. And it really makes a huge difference in horses' quality of life.
Well, and not all teeth are the same age.
Right.
If you look, the oldest tooth in a horse's head is what we call the 09 or the first molar.
Yeah.
And so that's the oldest, but some of those others, they're a year or two behind. And those teeth, the older teeth are going to wear out sooner.
Yeah.
And they don't all, and like I said, the maxillary teeth don't wear the same rate as the mandibular teeth.
No.
So yes, these may be, let's say the mandibular teeth are expired, but that maxillary tooth is still growing. We still need to work on that maxillary tooth. Right,
because you run into, like I was talking about, the occlusal abnormality. So when that 9 is, the 09 on the top is expired, it does what we call cups, and so it kind of comes up and it's like a little cup there at the top, and that that mandibular tooth on the bottom that's still erupting now becomes what we call a ramp or a step, and where that tooth gets really tall. And so then now you've got like a triangle that you're trying to glide across a flat surface, and that doesn't work very well. So you've got to take that tall tooth down to be able to let them chew side to side appropriately, or what we call lateral excursion. So,
and that's important because when that lateral excursion is reduced, that's when we start to lose a lot of grinding ability.
Yep.
And that's also why when we're looking at teeth, a lot of people think we're looking at sharp points, but
that is not all.
It's a whole lot more to that. And we're going to get into floats here in a minute and things we're looking for. But I like a friend of mine. He's a dentist. He's a veterinarian, specializes in equine dentistry, and he doesn't like the term a float.
Yeah.
He likes to call it a dental equilibration. And
we call them occlusal adjustments.
Occlusal adjustments.
Yeah.
I think both of those are probably more, probably better. I think they're more descriptive of what we do than an actual float.
Well, because the float's the layman's term. It comes from floating concrete. So,
And there's a lot more to it than just floating them down.
Yes.
He used to always talk about you have to balance the mouth. And
Ooh.
we met when we were in vet school, and I was a farrier, and he was he'd done a lot of dentistry beforehand.
Balance a foot, balance a mouth.
Right. So we talked a lot about balance. He's like, you got to balance the mouth, Dan. You got to and I was like, well, no, you balance a foot. And then the more I learned from him, I realized, yes, you have to balance the mouth.
Mm-hmm.
There's a lot more to this than just
Yeah.
knocking some points down.
Yeah.
So that's a little bit about the anatomy, and the anatomy affects a lot of other structures because it's not just the tooth, but it's also, these teeth are involved in the sinus cavities as
Right.
well.
Yeah. So especially you look at this skull and you think, okay, 3 to 4 inches of tooth, that's coming all the way up into this sinus. And so we talk about definitely the last 3 molars, but sometimes that third premolar as well, will be involved in those sinus cavities. And so if that tooth becomes diseased, then that communicates directly with the paranasal sinus, and then now you've got secondary sinusitis, which is something that we deal with a lot.
Yep.
And you've got, close to those sinuses, you've got blood vessels, you've got nerves, you've got, lots of important structures that run through that area. And so we've got to be very mindful of dentition and oral health because it does affect the rest of the head.
Absolutely. And dental health, we've seen it in people. It plays a huge role in the health of people from a bacteria standpoint.
Yeah.
And septic issues.
The head is very, very vascular, and the mouth is very vascular.
Yes.
So if you've got raging infection anywhere in there, it sets you up very easily for bacteria to get into the bloodstream and then travel and wreak havoc on everything else.
I've had a few that I'll never forget. I had one that we were actually evaluating for kidney issues, but it all stemmed from we had a really badly infected tooth, led to a septicemia.
Yep.
These bacteria seeded out into the kidney, causing a pyelonephritis. The pyelonephritis set us up, and we ended up in kidney failure. And because of the kidney failure, the lungs were actually congested. We're actually headed to a congested heart failure.
Jeez.
Scanned, we had a vegetative endocarditis.
Oh, no.
And this is all from a bad tooth.
Yeah.
And
Which
so-
happens in people, too. I
Yes.
remember I had a heart murmur when I was a kid, and I had to take amoxicillin before I went to the dentist every single time because of that exact
Right.
concern. So
it's
real.
it may just be one small part of the horse, but it can have pretty major effects.
Yeah.
One of the other things that we see, the temporomandibular joint, that's the joint where the mandible articulates with the rest of the skull.
Yep, your TMJ.
TMJs. When these mouths, let's say out of balance, to use Nick's term, when they're out of balance, when they need equilibration, they're chewing in such a way that can actually lead to TMJ problems.
Yeah.
That can have an effect on riding. Especially when you're in these double bridles and dressage, or you're needing that collection, you're needing good contact, and when those TMJ joints get sore, they really fight you on that.
Yeah.
And I think it's amazing what you can do with a float to earn
Even-
equilibration.
Even before you get to the TMJ, like just having sharp points or just dental pain in general, I've seen lots of horses, barrel racers, they will blow out past a barrel because as soon as you go to touch their mouth, they just can't deal. Horses that are landing fences, and if you snatch their mouths, they're bucking you off and taking off. Like, dental pain is real, and it definitely does make a huge difference.
No, I agree. I think I think we're now starting to figure that out. Used to, this was about, can we make them eat better and gain weight?
Yeah.
And now we're figuring out that the dentals affect performance.
Yeah.
And that kind of leads to, used to you went out and you floated a mouth. You would just go out and do a float. When we're getting into these equilibrations now, I think probably the number one thing that we do every time we do an equilibration, and most people don't even realize we're doing it, is a thorough oral exam.
Yeah.
And if you've been listening to our podcast, you probably noticed a single theory in here. It all starts with the exam.
Yeah.
No matter what we're talking about, it starts with the exam.
Yeah.
That's really and truly where it all begins.
Yeah.
And so when we go out to do this, you may see us looking in the mouth, but what we're actually doing is performing an oral exam. And we're evaluating not just the oral structures inside, but we're evaluating, like, is there odor?
Yeah.
How does, we're going to ask you questions like, how's he chewing? Chewing heavier on one side than the other. You have any issues with bits?
Any nasal discharge.
Nasal discharge.
Yeah.
We're going to feel those TM joints.
Yeah.
Like, are they effusive?
Yeah.
Do they seem painful in palpation? And so, those are kind of the exterior part. But then we get into this oral exam. Like, let's go through that. Let's talk about one of the things, proper sedation.
Yeah, I was just going to say.
I don't think you can do it without it.
Step
So
one
let's start
is
there.
sedation. Yeah,
Yes.
it's for the horse's safety, for your safety, for completeness and thoroughness. Like, that horse has got to be sedated,
Yes.
in my opinion. We are putting a speculum in the mouth, which is a contraption that basically bridges onto the incisors and helps us open that mouth and hold it open so that we can look at everything, and we can look all the way to the back of the tooth.
Yep.
I want to look all the way, even past that 11, and look all the way to the back of the mouth, and be able to get my hand all the way back in there safely without getting crunched on, and then just to make the horse more comfortable, to make the horse more calm. There's a lot of bright lights involved.
Yes.
So trying to just let them be as calm and sedate as possible is always step one. I mean, if you don't sedate them, I don't think your exam is really worth anything.
I agree.
Honestly. So we get in there, we get this, before we even get the speculum on, I like to look at the incisors in the canines. I like to test my lateral excursion, so I'll lift the head until I know that the cheek teeth are in contact with each other, and then you move the maxilla and the mandible opposite directions, see how freely they're moving, and see how much movement you have. And then we'll put the speculum on, we'll flush the mouth out, we get all the food particles out so we can see everything. And then we're looking for, do we have any occlusal abnormalities that we can see? So ramps, steps, waves, missing teeth, things like that.
So let's talk a little bit about that. You said ramps.
Yeah.
Let's go through, what is a ramp, what is a step, what is a wave?
Yeah.
Let's talk about what those are, what they mean.
Yeah, so a ramp is when the teeth they're shorter in the front and then they go really tall to the back. That's a ramp. A step is when you've got teeth that are all the same height and then all of a sudden you've got one that's taller than the rest. That's a step. A wave is kind of like they're shorter and gradually getting taller in the middle, and then they're going to get shorter towards the back. That's a wave.
You got hooks on the incisors.
Yep. So hooks on the 06s and the 11s. So you'll get hooks on the front, the first premolar on the top, and then sometimes you'll get one on the last molar in the back or on the bottom. And so those are hooks. And then your incisors can have, just like the cheek teeth can have fractures, they can have lots of things that are affecting them, spaces, periodontal disease, EOTRH, all of those things, which we could talk about later.
Yep.
But we're evaluating all of these things. We have this whole checklist that we're running down, and it might seem like we're doing it quickly, but we are truly looking at all of these things. We're looking for dental caries or cavities. We're looking for diastemas or spaces. We're looking for feed packing. We're looking for lots of things.
Yeah, because when we talk about the diastema, that's that space between those molars.
Yep.
And I think a lot of people don't realize like how tightly packed, and those teeth are designed to do that. So the teeth up front are pushing backwards, and the teeth in the back are pushing forwards to keep them all scrunched up together.
Yeah.
And occasionally we get that diastema, that space in between.
Yeah.
And that's not a good thing.
No. The spacing, when you get space between those cheek teeth and then food starts to pack up in there, that's when you get to periodontal disease, or what they call gingivitis in people. So inflammation of the soft tissue structures or infection of the soft tissue structures around that tooth, that's the only thing that holds that tooth in the head. And so once those soft tissue structures get angry or they get infected or inflamed, that tooth can start to get loose, that tooth can start to die. And it's very painful. It's super, super painful.
Periodontal disease is very painful.
Yeah.
I've talked to people that have had it, and it's very uncomfortable because
Yeah.
you're right. I mean, you've got the gingiva and the periodontal ligament. That's all that's holding that tooth in.
Yeah, that's it.
And the periodontal ligament, we'll get into that eventually, probably not this podcast, but that's like right in there with the lamina of the foot. It's like one of those eighth wonders of the world,
Yeah.
you know.
Oh, yeah.
So we'll get into that. Y'all have to tune in for another podcast. We'll
Yes.
get into periodontal disease and periodontal ligaments.
But yeah, we have this whole list of things that we're looking at and evaluating, and it's the last thing on the list is the sharp points.
Right.
Yeah.
Very last thing. That's what everybody thinks about, but that's actually the least of our concern. we're going to take care of that.
Yeah.
And even during the oral exam, I have seen that change dramatically over the years. At first it was a light and we had a mirror. So like going to your dentist, a light and then a mirror.
Yeah.
One of the coolest additions we had a few years ago is an oral video scope.
I love that thing.
It is fantastic.
Yeah.
It's a scope that actually goes in the mouth. That allows it to, you can see it on the screen. And what I love about it is before, you're trying to show somebody something, you get a mirror in there, and like, oh, look at my mirror, see that?
They're trying to look in a space that's like 5 by 6 maybe, and like the mirror is all fogged up and they can't see it because the angle's not right and it's too dark and it's just, you can't see anything.
Yeah. And now I can put that on there and point to the screen and go, see that? That's a cemental caries.
And I can put that camera right up on
Yes.
that tooth and say, it's right here. I can take a picture of it. I can document it. We can come back and compare after we do diet changes and all of the things and see, have we erupted that carie out or is it still there? So, yeah, I love that thing. It's fabulous.
Yeah, it is. It's. I'm a toy guy.
Yeah.
And for whatever reason, cameras,
They're great.
Yeah, nothing. Seeing is believing, right?
Oh, yeah.
And that's what you got to have.
I remember when I came here for my working interview and you guys pulled that sucker out and I was like, oh, yes. Sold.
I'll tell you, I absolutely love it.
Yeah.
Like, especially when I don't float many horses anymore, but if I'm doing any kind of extractions or if I'm doing, I guess, more advanced dental work, that oral endoscope it's clutch.
You can see if your socket's clean or your alveolus is clean. You can see if you've got root left. You can see where it is. Like, it's just fabulous.
Well, even if you got to do a diastema burr, if we have
Yeah.
to make, so when we were talking about those diastemas, if we have a space in between those teeth, sometimes we have to actually go in and make that space bigger so the feed doesn't pack.
So it can fall out.
And
Yeah.
before, you were going in trying to hold a mirror, hold this other tool, go across there. Well, now I get the scope in there, have it set up. My tech's holding the scope,
It's very small.
and I'm back to 2 hands again.
Yeah.
And it is fantastic.
Yeah.
And like I said, really monitoring these teeth, because we're going to talk about cemental caries here in a minute, and I think that's one of the biggest. That's one of the places I really like it because it allows a whole lot better evaluation of that. So yeah, the oral endoscope, you got to have one.
Yeah.
And I'll absolutely love it. So let's talk about some of the stuff. And one other thing before we move on to cemental caries, one of the other things that people forget too when we're doing these oral exams, we're not just looking at teeth. Like you said, we look all the way to the back of the mouth.
Yeah.
I've had horses I've been called out for a float. You open the mouth and you look in the back and we got a melanoma off the soft palate.
Yeah.
We've got a melanoma or squamous cell off of the tongue. And it's like, oh, the teeth aren't the problem. We've got this mass that we need to deal with.
Or you can have foreign bodies stuck in there. Like, I've pulled a
Yes.
couple sticks out of between the maxillary cheek teeth that are just wedged in there, causing problems. Ulcerations on the cheeks and the tongues, lacerations, masses, foreign bodies stuck in the tongue or in the cheeks that cause, cellulitis and things, problems with their salivary ducts and, all of these things that we're evaluating. And like I said, it might seem fast. It might seem like we're just doing like a cursory glance and then we're like, okay, time to get out the power tools. But it's not. It's way more than that.
Now, we're checking a lot of boxes, and I've even noticed that when I go to the dentist, the hygienist is cleaning your teeth, the dentist comes and does his exam. It's the same thing. It may look like he's in and out in 2 minutes. But again, I've asked him, like, what all, just comparing notes. It's always kind of fun to talk to human dentists because it's like, oh, you can't do that in horse dentistry. And I was like, oh, let me tell you.
You can.
Well, next thing you know, the hygienist is mad because they're trying to get him into the next room, and y'all are in there talking dentistry because it's so much different than human. And so then I'm asking questions, and it was interesting because we talk about those same things when we do that oral exam. We said it may look like we're moving through there quick, but we're actually checking a lot of boxes and answering a lot of questions.
Yeah. Well, we learn to be efficient, right? Because the horse is sedated. They're not going to be sedate forever. We have to be fair to them and how long we have their mouth open. And so we learn to be efficient, but we are truly going down a very long list of things that we're looking at.
Well, I think that's the other thing when we talk about sedation for dentistry is horse comfort. Because they're more relaxed and they're not trying to chew on that speculum.
Yeah, because that's when you get a lot of discomfort when they're just chewing and chewing and chewing and they're just straining against that speculum. That can lead to a lot of discomfort as well.
TMJs get sore, their masseter muscles get sore, a lot of things.
Yeah.
So again, it all goes back to proper sedation. I remember the vet that trained me in school, Dr. Loud, he always said, if you cannot properly sedate horses, you can't properly do dentistry.
Yep.
And 100% right.
Yep.
So, Dr. Loud, if you're listening, thank you for that. Those some pearls of wisdom, as you used to say. So let's talk about one of the things that we see quite a bit, and again, my wife once said this about Lepto and dogs. She's like, Lepto sees us more than we see it. Mm-hmm. And I'll be honest, I think a lot of things in veterinary medicine, until you know what it is, you don't realize how much you've seen it. And again, I think equine dentistry in the last 30 years has really come a long way. And really in the last 15 to 20, it has exploded. Yeah. And so things that we didn't used to recognize, we do now, and now you feel like you see it everywhere. And one of those are cemental caries. Mm-hmm. You know them as a cavity. Yeah. But a cemental carie, and because of the way a horse is tooth shaped, it appears a little different than our cavities. Yep. And so let's talk a little bit about those, because again, I think more horses have these than we previously realized. Yeah. And they do cause issues. Mm-hmm.
Yeah, so they occur, just like Dan said, it's a cavity. So it's a decay of that cementum in the tooth, and the cementum is softer than enamel. And so as it is removed by bacteria and infection and things, it eats away at the integrity of the tooth and the bulk of the tooth. Mm-hmm. And so it can lead to, if it goes unchecked for long enough, it can lead to fracture of the tooth, pulp exposure, and the pulp is where your nerves and your blood vessels and everything that keeps that tooth alive live. And so if that pulp is exposed, then that tooth is incredibly painful, and then is prone to, like we talked about earlier, infection that then goes into blood vessels and goes all around. And so caries can be a big issue. And so as we're learning more about them, we're learning that, it's partially probably a genetic thing, just like it is in people, but also, what is their diet like? What are they eating? How acidic is the water that they're drinking? All the things that we know in people in our dentition, but we're starting to realize, like, oh, this actually, it works for horses too.
The same in horses.
It's the same thing. So, but yeah, I think like Dan was saying, the more we know about it, we definitely, I can think about, because we just read a paper the other day on peripheral caries in our doctor's meeting, and we were all like, oh man, we can think of 5 mouths off the top of our heads. It's like, oh, okay, they had a very low grade, and
Well, in peripheral caries, nobody recognized those as caries. We assumed forever, like, oh, they just chipped off part of that tooth. Yeah. We didn't realize, like, no, this is a pathologic problem. Yeah. Like, this is a peripheral carie. Like that was the first thing we identified was a cemental carie. So that's where the middle of the tooth looks like it's kind of hollowed out. Mm-hmm. But we didn't realize that these peripheral caries, because there's cementum on the outside of that tooth. When you look at a molar, that's cementum out there, not enamel. Yeah. And those are real. Mm-hmm. And so we need to, and that's, again, going back to being proactive. Yeah. That's when you recognize this and say, okay, now let's start asking the questions. What's the water source? What's our diet like? What kind of hair we eat and grain are we feeding? Things like that, so that we can, if we need to, we can make those adjustments. And it's a whole lot easier to stop a peripheral carie before it becomes, because they have a peripheral carie, it's going to eventually lead to a full cemental carie. Yeah. So let's stop it now. Yeah. And the nice thing about the horses being hypsodonts and their eruption is, if we can get that change made in time, then, that we can save that tooth. And so it's not like in people where all the tooth you have is all you have. Right. And so we have a cavity, they've got to drill it out, they've got to fill it, they've got to do all these things, which I think they're starting to maybe be able to do in horses. But they're doing some, but the issue you run into there is, don't quote me on this, but I think I went down a rabbit hole. Yeah, I think human molars have got 2 dental pulps. Yeah. If there's a dentist listen, maybe chime in and let me know. Again, we have enough to do just learning horses and then other species, so not up to speed on the human side. But horses have anywhere from 5 to 7 pulps in a molar or premolars. 5 to 7 pulps in there. Yeah. and some of them communicate. Depending on the age of the tooth, they can communicate.
Yeah.
So being able to go and drill and file and clean that out isn't
not
really a
straightforward.
viable option. Now, incisors,
Yeah.
one pulp, we can do that.
Yeah.
That's very, very doable.
Yeah.
Canines, kind of doable, except the way it makes this weird 90-degree bend, and it depends on how deep it is, I guess I should say.
Yeah.
But molars, not until horses are older.
Yeah.
Once they get older, some of those pulps start to separate. Not as many of them are communicating, so it is a little more possible.
Yeah. But yeah, people definitely ask, like, oh, can you drill it and fill it? And we're like, no.
Well, and I can tell you, I can remember when I got out, if you had an exposed pulp, that was a tooth that needed to be removed.
Yeah.
And that's how we were taught.
Yeah.
You would go through this part of your oral exam, and if you noticed a pulp that was exposed, that was when you were recommending, like, hey, we need to get this in for extraction.
Mm-hmm.
Big changes.
Mm-hmm.
We now have realized that secondary dentin, if we manage that tooth correctly,
Mm-hmm.
if we equilibrate that tooth, if we get that tooth by taking some of that tooth out of wear, secondary dentin can fill in, and we can actually save that tooth.
Yeah. Because we were just talking about this the other day too, like how our parameters for extraction have changed
Greatly.
We used to, if that tooth was loose at all or diseased at all, it would come out.
Right.
Like ASAP.
Need you in next week.
Yeah. But now we leave teeth in as long as we possibly can. We try to do everything we can to get that tooth to, if it's loose, we try to correct any other issues that may be going on, like the periodontal disease and other things. We take that tooth out of wear, and so then we try to get that tooth to tighten back down. We try to get the disease to stop, so we try to save teeth as long as we can. Of course, there's some instances where if that tooth is truly rotten, or if it's like asking to come out, essentially, I'll take it out. But we try to leave them in as long as we can, and that's changed a lot.
That's been the last probably less than 10 years.
Yeah.
Because I can remember when I'd go to these dental CEs, what we focused on was extraction.
Mm-hmm.
When you went to a dental CE, what they were there to teach you is how to extract a tooth. And I think about it, that's sort of what the beginning of human dentistry was if a tooth went bad, you pulled the tooth.
Yeah.
So dentistry focused on pulling teeth.
Mm-hmm.
And it was the same thing in horses. We focused on pulling teeth, and now we're learning, like, wait a minute, the tooth's always better in the horse's head. Because when you pull that tooth, you set yourself up for a lot of other issues.
Right.
And so if we can save that tooth, then, again, we talk about this all the time, save the cheerleader, save the world, save the tooth, save the mouth.
Yeah.
And so I think making these changes to how we do these oral exams and are getting rid of some of these preconceived ideas has really changed how we're managing these mouths. And we pull a lot fewer teeth, and I'll be honest, it makes me really wonder how many teeth I pulled that maybe didn't need it.
Yeah.
But again, the information we had at the time 10 years ago,
Yeah.
that tooth's bad, we pulled the tooth.
And like I always say, you do the best you can with what you know.
Right.
And once you know better, you can do better. But until you know better, then you just do the best you can.
Right.
And so, that's the crazy thing about vet med and medicine in general. It's always evolving. We're always learning. No 2 days are ever the same, which is great. And so, like I said at the very beginning, dentistry is a place where we can learn a lot, and we have a lot of climbing to do, and I think it's going to be I think as the years go on, it's going to be a very big part of equine med for sure.
It's a growing field, definitely, and like I said, just something as simple as that paper that just got published on peripheral caries, that wasn't a thing we saw. Everybody would talk about it, but we're like, we have cemental caries. I mean, I remember cemental caries in the last 5 or 6 years that those became real.
Yeah.
And nobody knew what was causing them. And I can remember used to, if you had a chronic cemental carie, you pulled the tooth. Well, then we started learning how to manage that tooth with taking it out of wear. And now, very seldom do we pull a tooth with a cemental carie. Mm-hmm. Now, we may need to float that horse every 3 to 6 months. But again, we're saving the tooth.
Yeah.
And that, again, pulling a tooth, and I get it. I pull a lot of teeth, or used to pull a lot of teeth. I still do a few extractions, but once you do that, you're committed. And it leads you to a lot of, like we've already talked about, leads you to a lot of things. Again, save the cheerleader, save the world, save the tooth, save the world. So.
Yeah, leave them in there as long as we can. They're in there for a reason. So, but yeah, I think we talk about, actually what is the float then. I mean, the float, when you get down to it, is just the float itself is removing those sharp points and equilibrating the mouth. So we use the power tools for that, the power floats and the Terra floats. And I have never been good at using a manual float. I'm spoiled in my little baby vet era and I've had to use them once, but I didn't like them. So
I've got one person I still hand float for. Just because she really wants it done, and I'll still do it. And if anybody's listening thinking I'm going to hand float your horses, it's not going to happen.
No.
I've just been doing it for so long for this particular person. But I guess it was, one, we had to be able to hand float. When I was in vet school, we had to learn how to hand float before we could use power floats, because there were really only like 2 brands of power floats out there when I was graduating.
Yeah.
And it was a rare occasion a practice had a power float, so we still had to learn to do them by hand.
Yeah.
And I think it was easy for me because it's not much different than rasping a foot.
Yeah.
And it's about pressure and how you let the tool do the work.
Yeah.
And so it's very quick for me to sort of learn how to do that. But it's a difficult thing, and to be straight up, I'd much rather power float your horse.
Yes.
I would much rather use a power float.
I think the horse would much rather be power floated as well.
Well, and a lot of times people, when power floats first came out, there was a lot of concern. They're like, oh, we're going to get this tooth too hot. We're going to have too much friction, get the tooth too hot. There's going to be too much vibration on the tooth. And I think, with anything, there's good and bad.
Yeah.
But if properly used.
I have seen one horse that was way overfloated, and he did have thermal necrosis of his mandibular arcade and his maxillary arcade, but that was one horse, and who knows what his history was. But if they're used properly, that risk is minimal. Yeah,
because if you don't have technique, technology will never save you.
Correct. Yes.
So you've got to have right technique. It's not the tool's fault. It's the person's.
It's user error.
Yeah. So and a lot of people are like, oh, I'm worried, and it's not as big of a deal now. But used to, people were worried like, oh, that power float is going to mess my horse's mouth up. And I mean, I think there were some occasions of that when we were learning how to do it, and if people aren't properly trained, it can be an issue. But again, any tool can be a friend of mine always says, like, any tool can be a weapon. It's the user that determines what it is. Yeah. A scalpel blade's not good either.
No.
If used incorrectly.
Just stab it.
Yes. It's got to be used correctly.
Yeah. But yeah, I always like to show people too, like you can run the burr on the pad of your thumb, and it's not gonna cut you. It's not gonna catch anything. It's truly designed to work on that tooth surface. So, but yeah.
So I know we didn't get into floating much today. I think we're gonna have to do another episode of what all's involved in that. But
that's okay.
I think covering this oral exam, I do believe that's where it all starts. It's where it all starts. And I think going through that today is really important because, again, that sets us up for what we're going to do with the float. So we'll do another episode on floating or dental equilibration, or what did you call it?
Occlusal adjustment.
Occlusal adjustment. Yeah. Yes. We're going to have some great terms for this. So we'll do another episode on that. So thanks, everybody, for tuning in today. Dr. Caitlyn, thanks for being here.
Absolutely.
Look forward to continuing this conversation. Let's dive more and more into what we're doing in horses' mouths as we go into dental month. So again, if y'all got any questions, if y'all got any ideas for future podcasts, things you want us to cover, and y'all been sending some great stuff. We've got some great ideas that people want covered, and I promise you we're working on it. We're trying to get these episodes out as fast as we can, but we do still have real jobs. We still have to be veterinarians. But really, thanks and keep sending those ideas in. Keep listening. We may not have covered the topic you sent in yet, but we promise we will.
We'll get there.
DM us.
Send a carrier pigeon.
Send a carrier pigeon. We're still waiting on the letter. Dr.
Yeah.
Caitlyn, if y'all tuned in a few weeks ago, She's never gotten a letter before in the mail. Like, nobody's ever put a stamp on an envelope and sent it to Dr. Caitlyn. So the first person that does that, we will be sending you some Countryside Equine swag. And if we've got it by then, some Equine Vet Connect swag. We're going to take care of you. So send that letter. DM us, text us, email us, call us, carrier pigeon us. I don't know what other ways
I
are.
think that's it.
Is that it?
I think you covered
What do you
it.
call a snap? Is it just like a Snapchat?
Send a
Is
snap?
that a DM?
No.
No, a DM is on, what's that, on Twitter?
Facebook.
Facebook, okay. Sorry, I'm showing my age here. I'm going to still pick up the phone and call somebody.
That's fair.
you know,
That's the easiest way to do it.
Or drive over to their house, knock on the door.
Oh, gosh.
Yeah, I'm
Well,
still
that's-
old school. I don't think anybody does that anymore. So, all right, well, again, thank y'all for tuning in. Look forward to seeing y'all next week. Take care.